Hi everyone, it's Dr. Gurubasava Lakamaji, Consultant Gastroenterologist, Prakriya Hospital, Bangalore. So I completed my DM-Gastroenterology from IPGMER Institute, Kolkata. Followed by that, I did fellowship in advanced procedure like endoscopic, ultrasound and ERCP at Dinnath Hospital, Pune. I have working experience of more than 10 years in various hospitals in Bangalore and in other cities. So today we'll be discussing something about the gastroesophageal reflux disorder, the important disease that affects commonly a lot of people. So this is a disease characterized by symptoms of reflux of gastric contents into the esophagus at least minimum 3 times a week, and it should impact your quality of life. This disease is found to be prevalent in about 18 to 20% of the population in India. Of course, these are out of studies. I think in general public, the prevalence could be much more higher. There are various factors which lead to this kind of disease like obesity, age, pregnancy, eating habits. So whenever we have these kind of factors, there will be more and more possibility of GERD. So what are the symptoms of this GERD? It presents typically with the heartburn. So you have burning sensation in your part of the middle part of the chest. Apart from that, you have something the reflux symptoms where you get gastric content regurgitating, coming back into your mouth. Apart from that, certain set of these patients can also have difficulty in swallowing, vomiting and other kind of symptoms. So whenever patient present with these kind of symptoms, we take detailed history and do some relevant examination. Followed by that, if the patient deemed to be necessary, we will take him up for the endoscopy. An endoscopy is a procedure where we place a camera through the oral cavity into his stomach and will take picture. If necessary, we will take baths from the lesions that we found out on the endoscopy. So this will give us an idea if there is any GERD kind of presentation within the lower esophagus. So apart from that, we also do certain investigation known as pH manometry, impedancemetry, barium swallow, manometry in selected patients. So once we diagnose with the GERD, we start with the basic dietary management, such as we try to advise the patient to restrict certain type of foodstuffs which can exacerbate these kind of symptoms like spices, oil-rich food, coffee, alcohol, smoking. So these kind of food intake should be restricted. Apart from that, we also advise patients to drink plenty of water, not to lie down immediately after taking food, and keep the head end of bed elevated while lying down. So even if the patient is not responding for this dietary and lifestyle management, then we go for the next set of management, that is we treat with the PPI, proton pump inhibitors. They are the first line of therapy for any patients with the GERD. So usually you might be knowing these are like pantoprazole, esomeprazole, rabeprazole. So we start with the very basic dose, then as required we'll titrate the dose for the higher values. Then according to necessity, then we'll go for the different set of medications such as prokinetics, alginate products, sucralfate. And some of the patients who may not respond to all these medical management, they could also be candidate for the surgical intervention. The surgical intervention could be minimally invasive through the endoscopy like radiofrequency ablation, endoscopic fundoplication, mucosal resection, or it could be an open surgery like fundoplication if the patient is having hiatus hernia. So this is about the diagnosis and treatment of GERD, and if you have any symptoms which I just told you, you can always visit us so that we can guide you for the further management and treatment. Thank you everyone for patient listening.